My name is Artour Rakhimov, and today in this video I'm going to discuss questions related to what is a normal breathing course, how it relates to the Buteyko breathing method, and we can also even discuss such a very fundamental, very hard question actually, as I realized, what is the Buteyko breathing technique or what is the Buteyko method. And before we begin this discussion, I want to mention that there are many great practitioners, people who teach, who promote the Buteyko breathing technique already for sometimes for decades, who organized amazing clinical trials. We had, for example, great results for the clinical trial on cancer when people were able to reduce mortality by about 6 times for metastatic cancer, which in my view is the best even known, even conducted clinical trial on cancer. 6 Western trials on asthma, numerous clinical approbations in Russia for people with HIV, AIDS, liver cirrhosis, radiation disease after Chernobyl disaster, and many other conditions. So these are all great people who are working in this area, but what I'm going to discuss here, what is kind of my personal or specific interest is what are the innovations and developments in the Buteyko breathing method, which tools, methods, and techniques we apply while teaching our students how to retrain their breath so that they change the automatic unconscious way they breathe and how we improve body oxygen content. And the 4 directions of the normal breathing course that I realize really important and that I've been teaching it since 2001 would relate to safety, for example, safety of techniques that we use, use of application of the technique for more severe states of known conditions, for example, for people with more severe states of cancer, like maybe even metastasized cancer, when secondary tumors develop, diabetes, emphysema, cystic fibrosis, other testing and development of methods and development of techniques related to new and much more difficult conditions, and also how to optimize the method so that our students are able to spend less time and achieve better results, better long-term results in their breathing retraining. Now, if we think about what is a Buteyko method and should we follow exactly the ideas suggested by Dr. Buteyko, or should we maybe introduce our own ideas? That's also a very important question. And before going into this topic, I want to first kind of to think about the background, how we can define the Buteyko method and to which type of criteria we can apply. And I realize that there are different approaches that can be used in this area. So what is the Buteyko method? We can first assume that that would be anything that within the main idea of the method. And the main idea of the method was patented by Dr. Buteyko in his patent, Buteyko table of health zones, as I call it, where he found the correlation that breathing parameters, automatic breathing patterns of people have correlations not only with, of course, oxygen level, but with health states of people. And his Buteyko table of health zones includes also the medical or physiological norm, which is manifested in certain amount of CO2 in alveoli of the lung, certain results for the body oxygen test, and some other physiological parameters. So the main discovery, and this is how Soviet doctors and Dr. Buteyko viewed it, he suggested that the cause of many chronic diseases, and there are indeed now dozens of studies, you can find them on normalbreathing.com, for example, literally hundreds of studies in total, which found that people breathe too much, meaning ventilation is elevated in people with chronic conditions, whereas healthy people or people who lived, let's say, 100 years ago had much slower, much easier breathing day and night, 24 hours per 7. And we also have hundreds of studies which showed and proved that when people hyperventilate, we have less and less oxygen level in the body cells. So, and that's also become part of the main idea of the method, so that the first central criteria which we can apply, that anything that fits or suits in this idea that we try to reduce, slow down breathing, and we are looking for the methods and techniques which are able to help us to slow down, to reduce our breathing, that would be related or probably would be even a part of the Buteyko method. We can have, of course, long discussion in relation to different specific methods and techniques which can be used in this area. And we actually are going to do this type of discussion later today. Now, the next criteria which can be used for Buteyko method would be, this is how we often call it both in Russia and on the West as well. It's based on the idea back to nature, or the idea that we are kind of trying to restore conditions which were common during human evolution, something maybe that was common 1,000 or 10 or 100,000 years ago. So that it was a time when chronic diseases were virtually unknown. The rate was exceptionally small. We know it was like 1, 2, 3,000 years ago. People already knew about many conditions, asthma, diabetes, and so on. They were described, but the rate of conditions were very, very low. So, and therefore we can think about the Buteyko method, and this is again like one of the ideas which you can meet in some literature sources, that it's back to nature, something which kind of suits our previous lifestyle, which was common many thousand years ago. That can be considered as a part of the Buteyko breathing method, and that makes sense as well. And Buteyko, I believe Dr. Buteyko himself would probably agree with this idea as well. Now, next criteria which can be used in order to identify or define the Buteyko breathing technique as a specific fixed set of methods or techniques, and probably it would be the same set of techniques that was used by Dr. Buteyko and his colleagues during 60s, 70s, 80s, and 90s. Here, though, we have like a little hard question, because the method actually was evolving starting from 60s, and even in 1990 and later in 2000, there were quite big changes in the way how Soviet and Russian doctors applied the Buteyko breathing technique. And I'm talking about, let's say, Dr. Buteyko himself, colleagues whom he trained, medical colleagues, plus later, of course, if we talk about the biggest center, that would be, of course, the Buteyko clinic in Moscow, where now about 5-6 professional doctors, we teach only the Buteyko breathing technique. So the way we teach it now would be, I believe, very different. I know would be different from the way it was taught during, for example, 70s, 80s, and 90s. So the method was evolving, and we're also going to discuss these topics as well. Now, the next criteria, or like fourth approach way how we can define the Buteyko method, it would be not specific methods and techniques, not tools, but specific practitioners or closest people who somehow like managed to get like spirit of Dr. Buteyko, like his maybe mindset and so on. And they probably would be, as some people may believe, better certified or spent more time with Dr. Buteyko, so they were able to grasp like certain nuances, certain specific points. And that is also one of the possible ways of how people can view, how people can define the Buteyko breathing technique. And here I'm going to discuss this first criteria, like the ways how we can define the Buteyko method in reverse order. I start with idea of that certain specific or certified people, they know best what is the Buteyko breathing technique, because in my view, it's not specific people, but specific methods and techniques that can be reproducible, so that other people, new students and new practitioners, can apply these methods and can achieve better results. That would be more important factor, how we can define or test any health therapy. And I would believe that Dr. Buteyko himself would probably agree that something that works better, maybe due to changes in time, due to maybe conditions we had, like let's say in 60s, 70s, in the past, in Soviet Union, we had many parameters were different even in relation to lifestyle. So, and another criteria which Dr. Buteyko suggested himself, this actually can be found in his interviews, that he mentioned that actually a practitioner should have about 90% or higher success rate treating a specific health problem in his patients, in his students, and then this practitioner can be considered as a certified one, whereas if some practitioner cannot have 90% success rate, and that can relate to all type of conditions, it's not only asthma, let's say, or sinusitis, bronchitis, which are relatively easy to treat, but the same would be also true for much more complex conditions. Also, if practitioner takes, for example, people with cancer or diabetes, cystic fibrosis, emphysema, more severe, more serious health conditions, this practitioner should also have 90% or higher success rate, and that would be in accordance with Dr. Buteyko understanding how a practitioner should work. Now, another criteria that was used by Dr. Buteyko and his colleagues, that practitioners should be able to achieve and should have 60 seconds for the body oxygen test, which is very good result because people start to sleep like 4 or 5 hours. We have a lot of energy. We have, of course, no symptoms of diseases present in them. And that was something that was also common for doctors that he trained during 70s, 80s, and later. So that's kind of another criteria or factor which relates to that Buteyko method should be taught by people who have themselves very high body oxygen level. Now, if we look at the next definition, is that the next possible definition would be that what would be the original Buteyko method and maybe the original technique, the one that was common many years ago, like many decades ago, or maybe like 10, 20 years ago. Now it's 2016. Maybe this type of sets and techniques can be described as a Buteyko method, but as I already mentioned, there are many changes in the way Soviet doctors applied the Buteyko breathing technique, and that changes relates to various factors, not only necessarily in relation to breathing exercise, but also in relation to sleep, diet, physical exercise, and other factors as well. For example, we know that breathing exercises, it was common at the beginning during 60s and 70s for Dr. Buteyko and his colleagues to apply mostly short breathing sessions, often only 12-15 minutes long, but applying, of course, many of them so that these students can achieve 2.5 hours of total breathing retraining per day. And later, this time for one breathing session was changed. We practiced longer sessions, for example, in HS, up to 30-40 minutes long. But later again, like there was a second change, and due to various factors, maybe historical reasons, maybe even other factors involved, that they start to teach shorter breathing sessions up to 15-20 minutes, and that is more common these days. So can we now say that something that was maybe taught by Dr. Buteyko in 90s or at the turn of this century could be considered as the original or classical Buteyko breathing method? And then we can also probably assume that the Buteyko breathing method is based on those, again, fixed ideas, fixed methods and techniques that was applied by Dr. Buteyko in the past. Would it be true? If we assume that this is true, we also need to assume that everything that was written, suggested, and taught by Dr. Buteyko should be also applied by this practitioner who teaches the classical or traditional Buteyko breathing method. And here I'm going to provide a quote, a situation where it definitely would not be correct or right way to teach health. First, I would like to kind of mention, I believe it's at least for me, it's my personal conviction that Dr. Buteyko was the greatest medical man. And if I think like, okay, who would be, like maybe there are some other people who invented important health-related ideas, how to treat physical diseases, I would say if I would imagine several other people, maybe 5 or even more people, who would produce similar or best maximum impact on health of human beings, that in my view Dr. Buteyko would still provide more contributions than even several other people. This is how much I believe, how much was contribution of Dr. Buteyko in understanding of health and in creation of powerful tools which are possible to use against very serious health conditions. So, but here I would like to provide examples where we should be really careful in applying exactly the ideas that was mentioned or explained by Dr. Buteyko. This is what he wrote in the article. It was published in the proceeding of the second conference of Buteyko doctors, where like dozens of doctors shared their experience with application, like great results and so on. But this is what Dr. Buteyko wrote in the article, which is called The Theory of the Pathogenesis of Diabetes Mellitus, Basic Principle of Hormone Therapy. So he was discussing diabetes, application of the Buteyko breathing technique for people with diabetes, and he wrote that we are convinced that the increase of sugar level is not a pathologically damaging factor. Sometimes we observe a 10-fold rise of blood sugar, and so what? Nobody died from such a hyperglycemia. Sugar is not poisonous. That is clear for everybody. These days we know not only that sugar is poisonous. If we look at last decades, and this is like just probably last 10-15 years, research particularly became more known in relation to comparing what would be the effects of sugar versus effects of other energy sources, and that would be, of course, fat. So we can compare how glucose in blood and how fat, ketones, or energy sources in the blood, how they influence the state of cells and what would be the effects of different metabolism when we use either glucose or fat as main energy source. And what we know now is that not only high level of blood sugar, so Buteyko is saying here that high level of blood sugar is not damaging, but in reality what we know now, due to very recent research, and we are talking about hundreds of studies, that even normal metabolism of blood sugar, utilization of glucose by mitochondria and production of energy in cells, is actually causing much more problem. In some studies we measured inflammatory markers, and we found that whatever parameter we choose, when people use glucose as the energy source, this parameter would be worse or in the direction of poor health or worse health in comparison with when people use fat as an energy source. So we can definitely be certain that we cannot teach our diabetics that high blood sugar is not dangerous and nobody died from that. It's probably people would not die immediately, but there are known and very proven long-term effects of high blood sugar. And in fact, many complications of diabetes, like worsening of the vision, blindness, later maybe development of pathological processes, inflammation in extremities, in feet, and gangrene, other complications of diabetes, we also based on high blood sugar level. And we can definitely, in my view, we should not teach our patients, our students with diabetes, that high blood sugar is not dangerous. So this example shows that actually we cannot apply blindly anything that Dr. Buteyko suggested. And so this day we know that glucose has mild toxic and addictive effects due to existence of cleaner fuel, and this is dietary fats. Now, similarly, Dr. Buteyko had serious wrong ideas in relation to use and effects of breathing devices. For example, he claimed that if somebody would use a breathing device, let's say, actually Dr. Frolov, who invented the very famous Frolov breathing device, like hundreds of doctors right now apply and advise to the patients to use the Frolov breathing device, because we had close to about like 25-30 clinical trials on all type of health conditions where we discovered that Frolov breathing device is able to reduce medication, reduce symptoms in people with, again, asthma, COPD, heart disease, diabetes, long list of various health problems. And Frolov himself, when he invented the device, he actually understood the usefulness of CO2, and that was how he got an idea that people actually should be able to use some breathing devices, some methods themselves without breathing teachers, so that they can improve their health. And that was the idea why Frolov, who was a military colonel, invented the Frolov breathing device in the same city, actually in Novosibirsk, because he knew he worked next to Dr. Buteyko. So Frolov approached Buteyko and asked him, okay, I have now this breathing device, and it's based on the same idea of high CO2, which helps to improve oxygen transport and immune system and so on. Would you be able to help me to evaluate it, to promote it, and so on? Dr. Buteyko was against that, and he later explained that if people use breathing device, people breathe heavier, and then it would going to transmit on their breathing after the session. In fact, I use breathing devices already for more than 5 years, Frolov device and DIY breathing device, and I found that this is not true, that actually people are able to get high CO2 and higher result for the CP test, for the final CP test after sessions. And even if we compare the session of the same duration when people use, let's say, for DIY device or modified Frolov breathing device, we are able to achieve better results in comparison with Buteyko breathing exercises. So Dr. Buteyko, therefore, even though he was the greatest medical man by far, he made most significant health contribution. And at the same time, he was not right, for example, in relation to diabetes, and he did not have correct ideas in the use and application of the breathing devices. So I'm going to the next question. What would be my understanding of the Buteyko breathing method, I realize that's actually a very hard question to answer. And I believe that it's not people or practitioners or diplomas, but it's tools and results that we use in order to achieve better health. Now, some tools we are going to discuss later, and efficiency is in results, and the results in my view would be, first we can develop like certain safety factors for specific situations and conditions when people, for example, practice breathing exercises, especially. There are also safety factors in relation to physical exercise, sleep, diet, and so on. We can also think about the Buteyko breathing method as something where we can apply, find new methods, innovations, and techniques in order to achieve high success rate for more severe conditions. So more serious forms or more difficult conditions as well, more difficult health problems. Now, apart from that, it was a huge and still very large concern for me to find those methods and techniques where students are able to spend less time and achieve better long-term or overall results when we practice, when we apply these specific methods and techniques. And having, of course, like ultimately very long-term results, we are talking about like 2, 3, 5, 10 years later, what is going to be the health state of our students and, of course, practitioners themselves as well. That would be another very important topic that was important part, of course, of the original Buteyko, and in Moscow clinic it's definitely a very important factor right now. But to have these results, long-term results, and find the tools, maybe additional tools, even those tools which were not known and not applied by Dr. Buteyko and his colleagues in Soviet Union and Russia, that would be also, in my view, a part of the Buteyko method, and that was how I approached and how I started to teach the Buteyko breathing technique about 15 years ago.